All right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Women Physicians' Health is Paying the Price of Medicine. Jessie, welcome back to the show.
Thanks so much for having me again.
All right, what's your latest article about?
So this article is about this idea of physician patients sort of being the challenging patients, the patients who always have the complications. We call it sort of that curse of, if you're a woman physician having a baby, you will have complications. Or if we go in for surgery, we're the ones that will fall apart. And I started noticing this trend, particularly over the last year, that so many women physicians have chronic illnesses and chronic health issues and unusual stories of cancers at a young age and real physical consequences potentially of the work. And so I started really just kind of digging into it, and I thought that it was very worthwhile to share my own story so I don't have to share their stories, but really just in the notion of, I used to think my story was unusual, and it's clearly not. And so in my mind, I now wonder, I think it's something, we have this clarity around the data of women's living shorter lifespans than men if they work in medicine, but it also seems like there's a morbidity cost that I have never seen talked about. So I thought it was worth bringing up the conversation, and especially this idea that I think all of us think that it was something about us that we failed personally, so we don't talk about it. And it's sort of this hiding it and not having the conversations. And yet the more conversations I have with people, and I think much of it is, I do a lot of one-on-one work and I do very small group work. So it's not the kind of things that people talk about at a big conference with, 500 people or even 50 people. But when you're in a group of 6 or 7, these things come to light. And I'm just blown away by the frequency. And I think that it's one of these things that once we begin to see it and once we begin to share it, maybe things will begin to change.
So you're saying that there may be a connection, certainly, between the morbidity of being in clinical medicine and a connection with that and chronic illness. So I was wondering, can you share your story, and maybe you could also share some of the stories of the other women physicians that you coach or you see in your small group practice, your small group retreats, perhaps?
I'm happy to share my story. And I actually wondered for a bit, many people go into medicine because they maybe had an illness before, they've had experience with the healthcare system. And I actually was thinking that was not my story. I was actually a competitive athlete, and many, many women in medicine were competitive athletes. So they were really healthy people when they went into medicine. And I had complications with both my first 2 pregnancies as a young physician. So I was in my 20s, mid 20s and late 20s when I had my first 2 kids. And with both of them, I had very significant, and what I was told, unexpected bad luck complications. One is a med student and one is a resident, and completely different, completely unrelated as well. So that was sort of, I just thought, well, okay, bad luck. And then I had my 3rd baby not in training, and I took extra time before and after, which is actually the law in California. You get to do that. And I had 0 complications, same body. Actually, I was now 35, so I should have had more complications, but I didn't. And then as a mid-30, young 30-year-old, I ended up in the ICU with thoracic outlet obstruction, but I ended up having literally every complication in the book. And again, I should have been this young mom with a 4 and 8-year-old who was quite resilient. And I just kept being told, oh, it's because you're a doctor. Oh, it's because you're a doctor. And I kept thinking to myself, like, they keep telling me this. What is this all about? And I think we've all heard that. And we all worry, as a physician when we have a doctor patient, or, it's like they will have the bad luck. But I wonder if part of it is how we take care of ourselves. And really part of my impetus in doing this is I'd really love somebody to study it, because I think there's something there. And so, and my story didn't end with that ICU thing. I've had multiple random surgeries since then. And I, again, thought like, wow, I just have bad luck. But I'm beginning to wonder if that's true. And it's the frequency with which I hear this from other people. and we don't talk about it. There's a lot of shame around it and a lot of like, well, it must be my fault or I didn't take care of myself. So I think we really want to change the conversation and bring this out into the open. And, I think we are talking about fertility issues in medicine quite a bit now and sort of the cost of delaying. But I also think there's a cost of the stress, there's a cost of the hours, there's a cost of all of these things. And, I'm a pediatrician, so then there's a cost potentially to our children as well. And I think we just have this idea that we should sacrifice our own bodies or that they're kind of a liability if they fail us. And if we're really about health, we should be modeling it and practicing it culturally. I think that, I don't think that I could have done anything different along the way. It really wasn't acceptable. And I don't think that my women colleagues could do anything different in the current system. But if we potentially bring this out into the open, maybe we'll begin to change things. That's my hope.
You mentioned that you wish someone could study this. As far as you know, any data that supports that connection between chronic
Yep.
illness and practicing and training in medicine?
I couldn't find any. And, I'm thinking I've been working in wellness since 2002, and this has not really come up in my awareness until recently. And again, I do think it's that I do this very small group work and I do in-person retreats. So actually people often talk about it there, or it's relevant to things that they can do or not do. And I think, there's a lot of new data out also about women leaving medicine earlier. And I'm thinking, well, if it has this kind of cost on your health, it makes sense that you would make different choices when you begin to see it. But I haven't seen any data about it. And so, yes, this is absolutely anecdotal, but it's sort of, once I started noticing, you can't unsee what you keep seeing. And I thought like, wow, maybe someone will listen to this or read the article and either do the study or, I think, again, it's one of these things that until we start talking about it and try to figure out if there is a relation, I think nothing will change. And I do think the other piece is that we talk jokingly and kind of affectionately about this curse and like how all the complications happen. And that allows us to really ignore it, I think. And, we laugh about it and you see, we're just very accepting of it. And I wonder if we should be. In the law, there's something called an eggshell plaintiff, where if something happens to someone who has these underlying things, you have this cascade of complications. And it strikes me that I love that word. I'm thinking now we're all eggshell patients. That's why the complications are happening. But why are we the eggshells? And if we're here to improve health, what about our own?
So it goes without saying, of course, that training in medicine requires long hours and very little sleep. Some people are on call every 2 to 3, 4 nights.
Yeah,
Now, you alluded to the culture of medicine, right? And we've talked many, many times before
yeah,
about how difficult it is to show vulnerability. So
yeah,
tell us how you think the culture of medicine may perpetuate some of these chronic illnesses that you
yeah.
see from the women in medicine.
Well, I will use my own story as an example because, again, I think we can't know what's in other people's heads, but I know what was in my head when I came out of the ICU. I went back to work very quickly
Mm.
in less than 3 months with some long-term complications, some of which meant that I had to change some of the things that I practiced. I had a brachial plexus injury, so I could no longer do circumcisions, like physically. And there's something that a lot of pediatricians don't enjoy doing. And so there was a lot of tension around like why was I getting out of it when I actually could no longer physically do it? And a lot of pressure to come back quickly, like how soon can you be back? And a lot of pressure to show up fully immediately. There's not sort of this like, we see you've been through this really thing, let's ease you in.
Yeah.
That's just not how we approach it. And I don't think it's necessarily anyone's fault, but it is the culture. And I think part of that desire to have us just jump right back in is medicine, of course, doesn't backfill for us. And this was many years ago, but everyone else has been covering your patients. So they're just exhausted and depleted on top of their own. And so in a system where we don't have enough coverage at baseline, our absences impact other people, such that probably impacting their health, right? They're taking more call if you're taking less call. And so this culture does perpetuate it. And, there's also that culture of if something is wrong with you, you have to over explain and justify, and you should come to work. Before COVID, you should come to work no matter what. Just wear a mask, even if you had the flu, right? That
Yeah,
was the
yeah.
original culture. And so that has shifted a little bit. But I think, especially for people with sort of hidden things, autoimmune things that maybe people can't see, or, and most chronic illnesses are kind of hidden to some degree. There isn't really an acceptance of, you know, working less or working part-time is seen as like weak or a failure, especially early in your career. It's getting more accepted, but we really do judge one another. I don't think from a mean-spirited way. Our culture in medicine, of course, is, you should sacrifice yourself. But I think people are really sacrificing themselves, and we're making the consequences expected and almost laughing about it, right? Like this idea is just so commonly known as like,
Yeah.
there's the curse, or you're the doctor patient, so be careful because they're going to have every complication. But I do wonder why that is.
Now, I know that most of your clients are women. Are you seeing, just from talking to your other physician coaches, the same effect stress has on male physicians?
I don't think, I don't know. I would say that really most of my clients are women physicians. And I also wonder, my guess is probably yes. Although, there is this whole newer conversation about the second shift at home for women physicians, and then men physicians are not having babies, which just the physical task of that, along with many, many women now are having babies in training. So the physical piece of that, I think, is a whole other level, or the breastfeeding piece of that.
Mhm.
And then the psychological piece of the infertility, which is also, 4 times the national average. There is a study about that. So I think, or maybe it's 1 in 4 has infertility. It's much more than the national
Sure.
average. And I think I haven't heard anything about men, and I just don't have enough
Mhm.
knowledge to know. I do also wonder if, as women, we're really quiet about it, but I'm guessing the men are even more quiet about it. And so I don't know if there's a way to collect data in a more private way, or I'm certain that there is some impact there, but whether it's different between the sexes, or I would assume if it affects one sex, it's also affecting the other.
Now, you mentioned infertility a few times.
Yeah.
If we were to redesign medical training and medical culture to take into account biology and
Yeah, biology. Yes. Yeah. Yeah.
potential
Yeah.
association with chronic illnesses, like what would you do? Like how would you
Yeah.
reconstruct our healthcare system to take those factors into account?
Well, we would have to change training, I think, especially for people who want to go into fields that have longer training, because you're literally spending the entire time of training during your reproductive years. I heard a conversation at a women's conference recently about the idea of covering egg storage and fertility so that you can save them for later.
Hmm.
Part of me wonders if that's reasonable, I guess, but it's better than nothing. But could we make it acceptable? Can we make it acceptable to take longer and stagger things, and have it be less intense, and be really thoughtful about, I think a lot of our training is a relic of what we used to do. And so what is actually needed? Medicine has changed so much.
Yeah.
I'm thinking, I just happen to know sort of the law path because I'm married to a lawyer, and their training happens on the job
Mm.
afterwards, where they are actually making adequate money and they can work less time, and there's more flexibility built into it. It's still very challenging, but the way that we pull out residency and have it be a really financially challenging time means that most people can't or don't want to extend it. But is there a way to extend it, or is there a way to have a shared residency spots? Might be a way to do it. But there would obviously have to be a change in the way that we pay for medical school
Sure.
and pay our residents. But I do think the other change is if we as physicians can make it acceptable for our colleagues to take time for themselves and stop sort of having the mentality that the more you can tax your body, the more committed you are, and that we actually, want the physicians to be the healthiest of everyone. And so modeling that for our patients, right? We're telling them not to be stressed and to have time to exercise and to have time to eat and to have time to sleep. And yet we don't do any of that. I think it also lands somewhat hollowly. So changing the culture of medicine, which I will advocate, I think is going to be really hard because we have this big business in here and now
Yeah.
it's a business and they are counting on us to sacrifice ourselves. But if collectively we're not willing to do that anymore, and we're really also not willing to expect our colleagues to do that, I think that's really the first step. Because you can expect yourself not to do it, but then you're in a culture where that's the expectation and it's nearly impossible. I mean, I think it's not that I didn't stand up for myself or that other women are not standing up for themselves. It's really that the system is not set up to allow for it. And so until we really look at some of those pieces,
Mhm.
I don't think things will change. And I think if we don't have any data to say there's any problem, to me, this would be very compelling.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Women Physicians' Health is Paying the Price of Medicine. Jesse, as always, let's end with some of your take-home messages that you want to leave with the Kevin MD audience.
I think the biggest take home message is that we should probably stop calling it a curse and start looking at what is the reality, because a curse is just something that's out of our control. But if
Yeah.
we can find some linkages and consequences, that's where I think we would have the compelling data to make change happen. And I think when we think about one another and caring for one another and supporting one another, that is something in the culture of medicine we can change. We can advocate for it. In an ideal world, those of us who are leaders in this space can also advocate for backfilling if someone is out and making sure people have enough time and really letting some of those old practices no longer be acceptable. Because I do think a lot of what I see now is people who are in their later half of their career who have the consequences. And so, but they're the consequences of things that happened years ago, right? Because
Yeah.
it doesn't happen right away. And so how can we begin to advocate for the next generation? We do have this culture in medicine of like, well, I took it so they can take it too. But instead, the pediatrician mindset is let's figure out how we can change things for the next generation.
Jesse, as always, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
My pleasure. Thank you.